Hey there, welcome to Viruskenner. My name is Valerie. There are many ways in which a virus can be transmitted to humans, and one of these ways is through rodents. They seem tiny and innocent, but they are less innocent than they look. In this video we will zoom into the transmission of viruses through rodents, and Thomas will help us.
This is Thomas from the Netherlands. Today I'm standing in Boxtel and I'm gonna find an answer how viruses can be transmitted by rodents. To find this answer I'm gonna ask Marco Goeiebier some questions. Marco, you are a doctor, you know a lot about viruses that get transmitted by rodents. Can you maybe tell me why are we today in Boxtel?
Well, thank you very much, Thomas. That's a very good question. Why would anyone be in Boxtel? But there has been an increase in the number of rodents here locally. So the rodent population has increased to a high level, and that increases the chance of viruses being transmitted from rodents to humans.
And can you maybe give us some examples of virus infections that can be transmitted by rodents?
So one of the most important viruses transmitted from rodents to humans in Europe are the group of hantaviruses. And there are multiple hantaviruses, and these viruses cause disease in humans.
What kind of disease can they cause? How can you recognize a patient with the hantavirus?
It depends a bit on the type of hantavirus, but the ones we see in Europe and in Asia cause problems with your kidney, high fever, and eventually you could develop hemorrhage, so bleeding from any of your sides of your body.
Is there something you can do to treat those patients, or is there a vaccine or something?
Well, as is the case for many viral diseases, treating those patients is very hard. You can do supportive care, make sure that there's fluid, enough fluid in the body, make sure that they can breathe normally. But there's not really medication that cures a patient from hantavirus disease. So it's very, very important that you prevent being infected.
You say prevention is important, and you also say that the virus can be transmitted by rodents. But how does this transmission works, and how can you prevent it?
Well, that's a very interesting question. First of all, the rodent itself does not really get sick. So he walks around with the virus in its body, and he has no symptoms at all. And he sheds the virus in his excreta, meaning that the virus is in its urine, in its saliva, and in his feces. And these excreta are lying around, and they dry in, and then you get these virus-containing aerosols. And if you get these aerosols in the air, and you inhale the virus, then you get infected.
It's possible that the rodent is not even there, and you still get infected from its feces, that you can inhale those.
Exactly. The virus in the excreta is very, very stable. So it can stay there for a longer period of time. And then eventually when the virus is inhaled, you get infected. So it's important when you go into areas where rodents have been, and the excreta of rodents are still there, that you make sure that you don't do any activities that get these aerosols in the air, or when you do, that you make sure that you cannot inhale these aerosols.
Does it work if you wear a mouth cap or something, if you're going to clean maybe a place where a rodent was? If
you wear a mask, but that must be a mask that keeps viruses out. So those are specific face masks. It's not that everything you put in front of your nose keeps viruses out.
So we should be careful with handling excreta from rodents and, for example, cleaning places where these droppings can be found. Generally, a virus is transmitted through the air and not through direct contact with excreta that contains the virus. Interesting. But this mostly concerns the transmission of hantaviruses. Are there any other types of viruses that can be transmitted through rodents or bats?
So rodents are like key transmitters of viruses. They are very good reservoirs for any infectious disease, as it is. In Europe and in the North and South America you have the hantaviruses. In Western Africa you have the Lassa fever virus, which causes also hemorrhagic fever and is transmitted with a rat with many nipples. But more historically also bacteria have been transmitted via rodents. For instance, the pest, as we all know it, one of the most famous pathogens ever, was transmitted from rodents to human by the use of a flea. But you also have leptospirosis, which is still one of the #1 causes of infections worldwide, especially in tropical conditions and especially in less sanitary conditions, because the rodents get closer to humans and to other mammals. And leptospirosis, it's a very interesting bacteria. It's spirally shaped, and it gets shed by the urine of rodents or cows or dogs. And then it can be transmitted to humans on a different way than hantaviruses are transmitted. Hantaviruses are transmitted easily set dry. You inhale the dry particles, and leptospira are transmitted wet. So they are in the urine, they are in the water, and when you have little wounds on your feet or on your hand or the mucous membranes, these bacteria can get into the body and cause a disease that's very, very similar to hanta. So again, it's kidney failure, it's fever, it's hemorrhage.
What would be your advice when you live in these rural areas where there are a lot of rodents?
Well, first of all, you need to make sure that the rodents do not get close to the areas where you are daily. So do not leave any garbage outside, especially that it's not interested for the rodent to come close to your house. Then on the other hand, when you have activities where you have a higher chance of inhaling these excreta, you could wear protective gear.
In rural areas, but also in towns like Amsterdam, rodents live a very happy life. But we should be careful when we find excreta from rodents. They don't get sick, but we should be careful we don't get sick either. I hope we were able to give you all the information you need, and see you next time!